Coming up today, a life-altering diagnosis in a good way. How this man went from a cancer diagnosis to a new career at the very place he was being treated. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Back in 2020, Kyle Akers was working as a software developer, sometimes playing in a band as well, when he felt a lump on his throat. The first doctor he saw told him it was a benign cyst, but Kyle's mom encouraged him to get a second opinion. And on the same day as his appointment here at the University of Kansas Health System, he was diagnosed with thyroid cancer and would eventually need surgery. Fast forward to today, and we are happy to have Kyle Akers joining us in studio. And he has switched careers from software to healthcare. And we're going to talk about that here in just a few minutes. Yeah. Good to have you.
Good to be here. Thank you.
Yes, we're excited to hear more about your story. We're also joined by Dr. Aaron Buchek, a head and neck surgeon with the health system. And across from me is Jennifer McGoy, a clinical nurse coordinator in our ENT clinic here. And she has been involved with Kyle and his care since 2022. Good to have you ladies with us today. Thank you. So I want to talk about this. You were diagnosed with this thyroid cancer. Let's just start with where you stand today.
Sure. Yeah, I'm still getting some follow-ups because there's still just a little bit left that we are tracking, and when we make the call, we'll do one more surgery and hopefully get the last of it.
Well, good. Okay, so Dr. Buchek, a cancer diagnosis, we know can be scary for anyone. A lot of people want to, quote unquote, beat cancer, but what's it like and what's it about thyroid cancer that allows people to coexist with the cancer and live with it?
Great question. Thyroid cancer is a kind of a double-edged sword because obviously it is cancer. Nobody wants to have cancer, but on the flip side, it is typically a pretty slow-growing cancer. So advantage of that is it typically has a low mortality rate, doesn't usually long-term hurt people, but it can be difficult to fully treat, and it requires really long-term follow-up because it can take a long time for us to know if it's coming back or not. But the fact that it's so slow growing is a good thing, but can kind of complicate follow-up.
Does slow growing mean that the symptoms are hard to spot and understand?
Absolutely. Most patients actually present with no symptoms. The most common one are going to be a neck mass, or oftentimes it's found incidentally on imaging.
And that's what you just felt it?
Yeah, I've never had a single symptom from any of it.
It always felt good? You always felt healthy?
Yeah, totally. I just was sitting at home one night and doing the chin scratching
of
thing,
course.
and felt a little lump and was like, you know what, I'm 38 years old, I should be the guy who goes and checks things out and not the guy who ignores them.
But you certainly were not thinking cancer.
Absolutely not.
You were just thinking something that's
it's just a lymph node that's a little bigger right now.
Be smart, get in and get it checked out. Good thing you did. So is surgery the primary treatment option for this?
Yes, for most thyroid cancers, surgery is the first-line therapy.
What else might you do?
After surgery, oftentimes we give patients radioactive iodine. The thyroid gland takes up iodine. So radioactive iodine sort of acts like chemotherapy. It doesn't have the same side effect profile, but it goes all over the body. And the idea is that it will kill off any potential thyroid cells, including thyroid cancer cells, to fully treat it.
So Jennifer, how often do you see Kyle, and what are you and Dr. Buchek looking for when he comes to visit you?
Typically, we see him every 6 months to a year. We're looking at imaging and labs. We can test blood for a thyroglobulin level, which is an indicator, if it's elevated, that there's a problem.
So Kyle, we mentioned that you had a second opinion here, but take us back to the first opinion that you got. What kind of tests did they run, and what did the ENT there tell you to do?
It was pretty surface. He just kind of felt my neck and said, you know, it's probably just a little cyst. Let's just go in and take it out. And then, made the decision. I told my mom about it. They were like, well, they want to just do a little bit of surgery. She was like, look, I just went to KU and I saw Dr. Sue, and he's fantastic. Will you just go talk to him and just make sure that we're okay here? And when your mom asks you to get a second opinion, you don't say no.
Yeah, when your mom asks you to do anything, you don't say no.
That's what I meant.
That's what you meant.
Yes.
That was smart mom, and good boy for listening. So can you tell us where you felt? You said you were doing your thinking, and just, we all
I was doing
feel around.
I'm on the computer, like trying to think about something, and then it was just kind of like right in here, just a tiny little lump, and I was like, okay, I'll come check that here in a couple weeks. A couple weeks, it was still there. And was like, okay, it's time to just go make sure.
How did it feel? Like, how big did it feel?
Oh, it was small, like no bigger than like a dime. Just real
just a
tiny
weird little nodule. Didn't hurt when you've touched it?
Not at all.
Okay. So you mentioned you came to see Dr. Terry Sue. So what happened during that second opinion? What was that check like?
Sure. So right away he palpated it. He said, I don't think this is in a place that can be that same kind of cyst that the other doctor said. So let's really dive into this. We did an ultrasound and a CT, and we did a fine needle aspiration to do some cytology and actually see what was in the cells. And then that was when I got the diagnosis.
Okay, so what was that moment like? Had it gone through your mind that it might be a cancer diagnosis, or were you putting that far out? What just kind of went through your mind?
I was thinking it was basically anything but that, because I didn't know anything about thyroid cancer in general, and that's the last thing that your mind wants to go to, is that it could be cancer. So it was, I would say, a suboptimal moment to get that phone call.
Sure.
But once you kind of accept that that's what it is, and that you're with a great team who can take care of you, you put it in their hands, and you just go with, and you do what they say. They're the professionals.
Yeah, right. Okay, so how long was your recovery? And did you notice, what kind of changes did you notice after that?
My recovery wasn't really, really long. The scar, it's just in the neck, and you have some drains for a couple days. You come home, you get taken care of by some people. And then, 10 days maybe tops until the drain was out and I was off, all the stitches were out and I was off doing things again.
So were you expecting the surgery to be gone, the cancer to be gone after the surgery? Because you were told the cancer was still there. What was that conversation like?
Yeah, so the first surgery was to remove the full thyroid and then do some lymph nodes on the right side. And then we watched it for 2 years or so, every 6 months like they had mentioned. And there was just a couple little nodes we were still tracking. So then we started watching every 4 months, and then we did another aspiration and saw that there was still some there. And that's when we decided to do another broader surgery, and that's why I have my cool scar going all the way up to my neck on the other side.
We're going to look at that here in just a second. Dr. Buchek, how often does that happen? We're talking about a cancer near the lymph nodes. How often does that happen where it goes into there? So you have to keep a check.
Great question. Papillary thyroid cancer, which is the type of cancer that Kyle had, does like to spread to lymph nodes. So not uncommon. Now it does depend, whether or not it comes back or how difficult it is to cure or treat fully, really does depend on the extent of where it spread. So once it spreads to the lymph nodes on the side of the neck, which is when they found it, which is where Kyle's was, those can be a little bit harder to treat and fully cure just because it's already kind of, the cat's out of the bag, so to speak. It's already spread to these lymph nodes, which is why he was being watched so carefully.
Let's look at these incision photos.
Sure.
A little show and tell here. You're talking about the drain, but just kind of tell us what we're looking at and what this was like for you. Yeah, so these are
from my first surgery. It was, I'm not sure the right words to put into it. It felt pretty surreal having a giant tube going through your neck, making sure everything's draining well. And you, of course, have the moments when you see, and that was from my second surgery, you have the moments where you see these scars and you're like, I'm going to look like this forever. It looks like everyone tells me I should tell people I got in a knife fight or something. And I'm like, no, this story's way cooler. But the body heals itself so well, and my scar is almost unnoticeable at this point. But because I did have this second surgery between nursing school and when I became a nurse, my official photo on the wall on my floor, it is gigantic still. It is so the difference between the picture even from when I started nursing and to now, it's almost unnoticeable now. And my official KU photo is a big old scar on my neck. Yeah,
that'll show you how far you've come, right?
Yeah, exactly.
Dr. Buchek, but for us regular folks that are not in the medical field, that looks like a very large scar. Is that pretty typical for this type of incision?
Yeah, it's typical for the type of surgery that Kyle had to have. A lot of thyroid cancers, though, can be treated with just a thyroidectomy, and that scar is quite a bit smaller. But once it has gotten into the lymph nodes in the side of the neck, even if it's just one, we have to remove all of the lymph nodes that are around that one lymph node and that are at risk, which are typically the lymph nodes that go up to the jaw and all the way down to the collarbone. So that means a much bigger incision.
Yeah, we can see. So you shared some photos, some images with us of Kyle's. Can you just explain what we're looking at in these images?
Yeah, so these are CT scans that were done within the last 6 months of Kyle, and this is where the disease basically still is. And that red circle is encompassing a lymph node sort of below where his thyroid used to be. That black circle just to the right of it is actually his trachea, and so we call those paratracheal lymph nodes. So they're just right next to the trachea.
I think we have one other.
Yes. And then this is another lymph node that is a little bit further away off to the side of his neck, but kind of right behind his collarbone. And that's a second lymph node that still likely has thyroid cancer in it. But those are the lymph nodes that we're watching and keeping an eye on.
So, so Kyle, are you taking medications for this?
Yeah, I get to take levothyroxine every morning for the rest of my life. But they're 2 tiny little pills, easy peasy. The biggest impact on my life is that I have to wait to have my morning coffee. Because you need to wait 30 to 60 minutes after you take it.
Brutal.
I know. And as a big coffee guy, it was quite the impact.
Yeah, that's tough. That's tough. So I want to talk about the mental health aspect of this.
Yeah.
We talked to many folks who have been diagnosed with cancer or living with cancer, but what was that like for you? What advice might you have for folks that have faced what you have faced? And is there anything you did specifically to kind of help yourself through?
Putting my trust in the people around me is really helpful. Tapping into your support network. There's the double-edged sword of doing your own research online about things, but a lot of the support for papillary thyroid cancer, like Dr. Buchek was saying, is it's a very slow-growing cancer. The prognosis is really good. A lot of people, either just have to have one more surgery or they just make it all the way. As long as they're going to live with it just hanging out, and it's just kind of a new friend. So with my last doctor's appointment, I kind of talked about trying to not see it as like this invasive cancer that's attacking me, but just like a chronic condition that I'm just keeping my eyes on and dealing with as it changes.
Do you find yourself telling people to put their health first? I mean, even before you got into healthcare, which we're going to talk about in a moment, but were you telling people, hey, when you notice something weird on your body, get your screens, get your scans,
Absolutely.
get to the doctor?
Absolutely. I feel like the stereotype is that like men my age and stuff like that are like, oh, I don't need to get anything checked out, but you don't know what's going on in your own body. If you see something change, definitely go get it checked out. That's how you can catch things like this early and treat them while they're still very treatable.
Yeah, it keeps your options open for sure. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. The information is there on your screen. Of course, another huge part of the story, as we've been alluding to, is in the middle of the pandemic, while you're recovering from surgery, you have this awakening.
Yeah.
What happened?
So I had been working as a software developer for 7-ish years, and I kind of was like, okay, well, I know what this job is like. I'm good at this job, and it pays well, and I can do this. But I definitely felt like not quite as fulfilled as I wanted to fulfill. So I was looking at how to change my life in the software development career, and then I had my surgery, and I'm staying there in the hospital here at KU, and I'm recovering, and nurses are there taking care of me. The anesthesia team who talked to me ahead of time was so warm and comforting. And every single person I saw, I was like, these people are using their skills and their talents to one-to-one help people directly. And that's something that I want to do.
And you were 38 at the time. By no means is that old, but maybe a little later than usual.
On the older side.
On the older side. Well, certainly to start a new career, maybe in medicine, because a lot of people think you've got to go through it, and it's not easy by any means. So how did you do it?
Yeah, so I have some friends who are in medicine. I met with them. I made some phone calls to other people, to family doctors, things like that. And did all my research about how can I get practicing as soon as I could. I thought about med school, but then I was like, well, I'll be doing residency in my 40s. I think that would maybe be not super easy on my body to be worked as hard as it is to get through medical school. And then I learned about accelerated bachelor's of science and nursing degrees, where as long as you have a previous degree, which I did, you can do the entire BSN in a year. So I found one here at Research College and knocked that out in the year 2022. Did the whole degree.
Fantastic, and congratulations.
Oh, thank you.
And again, all inspired by people like Jennifer. We have this national nursing shortage, as we know. What's it like to hear when patients like Kyle are inspired to turn around and start a new career and become, of all things, a nurse?
Yeah, I think it's really beautiful. I mean, I think we all, nurses, are called to the profession because we want to care for people and make a positive impact on people. So hearing that Kyle got to experience that kind of gives me goosebumps and makes me happy to be a nurse. So.
For sure, for sure. Dr. Buchek, what's that like, just to know that people are inspired just by being around you and your team and your staff and watching them do what they do?
Yeah, I'd echo that. I mean, I think it's sometimes, I hate to say we sort of forget the impact that we have, because we don't, but it's really nice to be reminded of that, and that you made such a dramatic career shift at that point in time. It's very inspiring. So thank you.
Yeah, of course.
And you're a cardiac ICU nurse here at the health system. What inspired you to get involved with cardiology?
Yeah. So I I wanted to work in a critical care unit on an ICU for sure. And then when I came to the recruiting event at KU, they basically said, okay, well, we have a whole bunch of ICUs. What part of the body do you like the most? What system do you like the most? And I was like, God, the heart and the brain probably, but the heart for sure. The heart is amazing. It is a miracle to talk about all the time when I get to educate patients or talk to new students who I precept, to just be able to talk about how cool the heart is. As an organ, all the things that it can do, the fact that it can beat on its own without any help from the brain. I mean, it's
quite magical.
Yeah, exactly.
So, in your health journey, continues, but more importantly, your medical journey and your education continues because you're back at school again.
I will be starting at CRNA school in May. Yes.
And what does that tell people what that means?
Yeah, sorry.
I know, you're just a big, smart medical person now, and so you have to just dumb it down for people like me.
Nurse anesthesia. Okay. So it's a 3-year program. I'll be entering that in May, and I'll be doing a bunch of clinicals, and I'll be helping with anesthesia, spinal blocks, intubating people, helping in procedure rooms, or maybe in critical care situations, emergent situations.
Well, it sounds like kind of an easy question, but specifically, what is your favorite part about the job? I'm sure it's working with patients, but besides that, is there anything really cool about it that you love?
I'll be a bit of a nerd here and just the science of it. I'm on day shift and I get to listen to the doctors talk about all of the subtleties of the body and the ways that we're treating people for their heart failure, the heart attacks that they had, and just learning all the different ways that we can help out, all of the different medical advances that we've made. Every time I get to hear new things, it makes me excited.
Yeah, you're just like, you're surprised every day.
Exactly.
And it's a really cool time to be in medicine right now.
Absolutely.
As we watch things evolve every single day and change. So I want to get to some questions from our viewers this morning because we've got some good ones. And Stuart wants to know if you could explain more about that medication that Kyle's taking every day that has to delay his coffee. Why is that, and what is that, and what's that going to do for him long term?
So he's taking levothyroxine, which is thyroid supplementation medication. And when someone has had, for sure, a total thyroidectomy, and sometimes even when they've had partial thyroidectomy, we have to replace the function of the thyroid with that medication. Now, it's very time sensitive, and it's best if it's taken at the same time every day. The whole food and coffee thing has to do with the absorption. So it's much better absorbed on an empty stomach, and if you introduce food too soon, it isn't absorbed as well, and therefore it won't work.
Okay, well now I have to ask, is this, because I take some of, if I have a medication, I'll just take it with my coffee. So is this just this specific medication, or should people be looking and asking about that for other medications?
Well, you should always ask, because there are other medications.
Oh, I'm not asking. I'm just going to do it. Right? Just wait. We'll wait and see what happens. But no, I feel your pain on that.
Yeah.
Good for you. So I want to ask a question from Jeremy. He says the thyroid affects so many things, so I imagine that would be an extra uncomfortable place to get cancer. Does thyroid cancer affect overall the overall body in more ways than other cancers do?
Actually, typically not. It actually usually does not impact the function of the thyroid itself. It's pretty uncommon for that to happen. But the treatment for the thyroid cancer, that's what has the major impact, because we have to remove at least a portion and oftentimes the entire thyroid gland. And that's where we have to talk about impacting other organ systems and making sure that that medication that we start people on, that we have them on the right dose.
And on that, while we're speaking of that, what is the exact function of the thyroid?
Oh, great! It impacts almost everything in the body. Yeah.
Like, how to give us the top, thing that it does, and move on down.
People tend to think of it as a sort of metabolism, homeostasis. So, impacts cardiac, brain, all or other organ systems. I kind of tend to explain it to patients like, if your thyroid's overworking, so if you have too much thyroid hormone, it's almost like you're kind of amped up. You have a hard time sleeping, you end up losing weight. And then the flip side of that is if you have too little thyroid hormone, kind of fatigued, sluggish, tired, weight gain. So a nice happy medium is where we want to keep people.
So is the thyroid something that people go to, kind of a go-to checkpoint to see if something's going on? Like, oh, I'm not feeling this, or I'm feeling that. Let's check your thyroid.
Yep, very, very common. And it's easily done with lab work.
Marie wants to know, Kyle, when you're working, do you ever run into doctors and nurses who cared for you when you were recovering? What's that like to see them?
So there's a nurse on my floor who's kind of famous around here because he's worked here for so long, but he's from the Ukraine. And I remember being taken care of middle of the night. So I'm still like waking up from surgery, not like on my game entirely. But I remember a Ukrainian nurse talking to me, and I chatted a little bit with him. And then I come up here and I start working, and then he is up in our break room every morning. And I was like, you you were the nurse who took care. And he's like, I take care of a lot of people. I mean, it probably could have been me. But yeah, I am 99% sure that I was taken care of by a nurse who was on my floor.
So you wake up in a stupor in the middle of the night. You're like,
Yeah.
now you're seeing him in the break room, and you're like, I know this guy.
I think this has got to be him.
That's the guy. Ruth Ellen wants to know, what is the purpose of the lymph nodes in this particular area?
Oh, so lymph nodes take care of infection, inflammation. Their sole purpose is usually for clearing out infection, but they also can be a harbinger for cancer. And so they drain all parts of the head and neck. And we have a lot of lymph nodes in our neck area, hundreds.
Yeah, before I got the surgery, when I got out of surgery and they told me they took 20-something, 30-something, I was like, wait, I have that many? I thought it was just like these that you're like, ooh, am I sick?
Yes, yes.
But no, there's hundreds in your head.
That's exactly, yeah, the two you're always checking to see if you, yeah, for sure. Jonas wants to know, does chemotherapy work on thyroid cancer?
It can. It is typically not first line for thyroid cancer, and oftentimes the chemotherapy we're using in this day and age is targeted. So if you have a specific mutation in your thyroid cancer, we have some really great targeted drugs that have a lot less side effects and are very effective at treating the cancer.
June wants to know, what's different about cancer in the thyroid that makes it so slow growing?
That is a great question that I don't know if I or anyone has a fantastic answer for. But it's sort of similar to prostate cancer, and fast-growing cancers we think tend to have accumulated a lot of genetic mutations. And while thyroid cancer can have some genetic mutations, the ones that are really slow growing likely have not just accumulated those specific sort of aggressive mutations. But the truth is we don't really fully understand why.
Marie wants to know, will Kyle ever need another surgery?
I think it's very, very likely. I think we're at the point of not if, but when, sort of with Kyle.
Why is that? Why do you...
Well, there's still cancer in there, and with you being so young, which is great, there's a long time there. And so as it very likely will progress at some point, we just don't know when.
So you know it's there, you wait for it to slow grow till you can catch it, and then you go back in and get it. And then hopefully that would be...
Hopefully that would be it, but no guarantees, unfortunately.
Yeah. Very important question. Bonnie wants to know, are you still a performing musician?
We haven't played shows in a little bit, but every once in a while we'll get together and play with each other.
Okay,
We do.
Tell us more what you play.
Oh,
I gotta know. all the fun details. What do you play? What kind of music do you?
Yeah. I play the bass, I play guitar, and I sing. I was in a touring band for over a decade. We had a song on Gossip Girl. We did some things, so that was fun.
Don't gloss over
Yeah.
that.
Yeah, wait,
A
back up to
song
the Gossip Girl.
on Gossip Girl.
Yeah.
That's very cool.
Yeah, it was fun. We had a song on a Triscuit commercial too, that was pretty fun.
Get out of town.
Yeah, they did this. I'm not gonna talk about Triscuits. And then while we were home from touring, we would play like at bars and just do cover shows and things like that. And then we transitioned into doing weddings. So we played a lot of weddings, and then COVID came around, and not quite as many weddings that year.
Boo.
So we kind of put things on hold, played the ones that we had booked, and said, this is stressful. We're all doing other careers. I was changing careers, things like that. So now we hang out every month as friends, and maybe occasionally pick up the instruments together.
I love that. I love that. So Stu wants to know, what about the voice box? Did Kyle's voice change after the treatment?
So when I first got, that was a big concern, because I use my voice for that, and I do voice acting and these other things, and talking is a big part of anybody's life. So it is definitely a potential side effect, but I asked Dr. Sue before my first surgery, and he said his incidence rates were way, way, way low. And I woke up and my voice was fine. Really, the only changes that I ever felt was just some fatigue from not really using my voice as much for those first few weeks, but after those first few weeks, everything was kind of back to normal.
Could that happen? Can that affect?
Oh, yes, absolutely.
Very much so?
There's a lot of nerves that live around the thyroid that go to the voice box. And so most of the time people have sort of short-term, swelling issues with speaking and talking, but most of the time it's okay long-term. But you can have some complications from surgery or complications just from the cancer itself involving some of those nerves.
Okay, is the Triscuit commercial on YouTube somewhere?
What have
We've
I done?
completely shifted the direction of this medical program.
I think it's out there. Look, if you really want to look up
writing it down.
Triscuits, they did a brand, or like a campaign where they wanted you to put things on a Triscuit to make fun little recipes, and this one was the Cuke Feta Mint Skit. So it was a cucumber feta mint, and we had like a listening party when the commercial was going to go live, and we made those, and I'm not going to say that they're great, because There's other better recipes for Triscuit.
We don't care about the Triscuit.
Yeah.
We just care about hearing this
Yeah,
awesome
so the song, yeah, the
This
song
is
is
so
on
fun.
This,
Okay.
and the song, all our music's on YouTube and Spotify. The band's Antennas Up. If you want to look it up, it's still out there.
Okay, and then I'm going to jump on you about Gossip Girl
Okay.
when this is over. But last medical question. Stu has asked, has Kyle ever missed a day of that medication? And can you notice a change if you've missed it? Don't say you have, but have you?
I'm sure you have. It's okay.
I have. But
okay.
it comes with instructions for what to do when that
Yes.
happens.
Okay, good.
So just take double dose the next
Well,
day.
that's going to happen. I mean,
Easy
you know what
peasy.
happens. All right. What do you want the big takeaway from your story to be for those listening? What do
Yeah.
you want them to know?
Get yourself checked out. Don't be scared. Don't feel like you're too strong. We're all humans. Things change against our wishes, and we can get them treated. So don't feel too proud to go to the doc and check something out if something changes.
Even if you're a cool guy in a rock
Even if
band?
you're a super cool guy in a rock band, you can get thyroid cancer. And if you feel called to change your life, there's no right or wrong time to do it. You can do it in your late 30s. It's still a fun thing to do whenever you want to do it.
Well, best of luck with all
Thank
of
you
that.
so much.
I love that. You're going to stay in touch with us.
Absolutely.
Jennifer, what is the big takeaway today?
I think just take care of yourself. You have a great team here that will take care of you and help you through the journey. And just.
Well, thank you. Thank you for being there for people like Kyle, kind of before, during, and after when this is all going on. Dr. Buchek, what's the big takeaway today?
I think I'd echo that as well. If you unfortunately get diagnosed with thyroid cancer, I think it's really important to seek out, a place where they do this all the time, high volume center, because a lot of times it is simple, but sometimes it's not. And we can take care of you either way.
All right, thank you. Thank you to all of our guests today. We appreciate it. Thanks to our viewers and your great questions. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update. Counseling, medications, even magnetic stimulation. None of it could help this woman's thoughts of suicide until she tried a prescription nasal spray. I'm Jessica Lovell on the next Morning Medical Update. Hear what it's like using the only FDA-approved psychedelic treatment for depression. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.